Hello and welcome to Roundtable. COVID restrictions and lockdowns are on the rise in Europe, with the continent now accounting for more than half of all new cases worldwide. And it is a rapid rise, 60% up compared to August and September. Eastern Europe and Russia have been particularly badly hit. So why is it so severe there? And what can be done to stop the surge? Very good to have your company. I'm David Foster. A reluctance to get vaccinated has been put down as one reason. In Russia, they're trying to get more people jabbed by offering 2 paid days off work if you are inoculated.
We can see that the coronavirus situation is very serious in all of the Russian regions. The morbidity is extremely high. There are a lot of patients in severe condition in hospital wards. First of all, those who haven't got the vaccination in time. Doctors are fighting for their lives. It is important to push for the vaccination rate further. It is impossible to contain the spread of the infection without it.
We're going to be talking in just a little while about what the Russian Prime Minister had to say there, but let me introduce in the studio Oksana Pyzik, Global Health Advisor lecturer at UCL School of Pharmacy. We go to Seattle on the west coast of the United States and introduce Marie Kimball, epidemiologist and senior consulting fellow for the Center on Global Health Security at Chatham House, and then to Brussels, where we welcome back Kathleen Depoorter, member of Belgium's Parliament. So there we have Mikhail Mishustin saying it's impossible to contain the spread of infection without it. In other words, the vaccination rate going up. So, Anne-Marie, first of all, is that at all likely, or are we going to see it spread and spread through Russia?
You know, that's a fascinating question. Russia, of course, has its own Sputnik vaccine, and yet Russia has the highest vaccine hesitancy in the world. We're number 2, and Russia's number 1. So they have a lot of problem with their population compliance. And so it's going to take a lot of effort to convince folks to step up and get the jab.
In a country where many people see the leadership as being authoritarian, is there any possibility that in a country such as Russia, people will be forced to have the vaccines?
I think what you're seeing with the 4-month lockdown of elderly people in their homes as one of the measures being taken if they're not vaccinated, you're starting to see that other social pressures and other means are being used by the government to really incentivize the population to get vaccinated.
And what happens, Kathleen, let me ask you this one, I'll bring you in just a moment, Oksana. What happens if that rate doesn't go up from, what is it, around about 35% in Russia at the moment to what is generally considered to be safe-ish, which is round about 70%?
Yeah, 70 or even more, 85% is what Peter Piot is saying on behalf on the WHO. So I think if Russia sticks with the 35% or even a bit more, 40, 50, then they will have a huge problem because the virus is spreading all over the country. You have a lot of people who are dying, as I can read, a lot of people who are in hospital. Doctors are really struggling, so they should go on the street and convince their people to get vaccinated. I'm sure of that.
And what happens in other countries nearby in Eastern Europe? Why is it pretty poor there? Romania, Ukraine, Latvia, for example, very high rates of infection there.
I think in most of the countries where we have a high rate of infection, we see that the vaccination coverage is very low. As far as I can see is the scientific explanation of government is very important. And I've been talking to a Polish person who said that the vaccination rate was very low over there because this communication of the government towards the citizens was not really convincing, scientifically meant. So I think that when you communicate as a politician with your citizens, then you should be convincing convincing, not just saying you have to do it, but explaining why it is so important to get that vaccination, but also talking about possible side effects or the reduce of side effects. So really transparency and scientific information and education is very important.
Oksana, we're going to talk about the UK in some detail in just a moment and why the cases in this country are rocketing. But the vaccination rates in the UK are very high indeed. Why is it possible to convince people in this country but not in, let's say, Russia? Well, Russia's a special case, I think, but Romania, Latvia, Estonia, those Eastern European countries.
It's a huge challenge, and there are also cultural divides. A consequence of that vaccine hesitancy, alongside having very severe underfunded healthcare systems, make it even worse. That compounds that problem. In the UK, although I would say it was far from perfect messaging, there was a lot of not only having our chief scientists and chief medical officers doing almost daily press briefings at the height of the pandemic, that communication that people came to expect and rely on, really to understand what they could be doing tomorrow, the week after. All of that, in addition to ensuring that you have that local public health influence. In the UK, we also leveraged religious leaders in mosques and churches to vaccinate after Mass. And that's made a big difference because it went from the very top level down to the community.
Can I read out some figures, first of all, for last year, 2020? The November 2020 peak in Europe was 320,000 infections a day. By June of that year, it had gone down to 32,000. And yet in October of this year, it's back up to 223,000. Not as high as it was 18, 15, whatever, months ago, but going back up. And why has it spread? I can understand why there are problems if people don't get vaccinated, but why has that actually happened?
Well, we can also take a look at between the UK and Western Europe and see that vaccination alone, at this stage, the UK went out fast and hard, and we have a very high vaccine coverage. But we are now surpassed by many other Western European countries who have higher vaccine coverage, plus other measures, including things like vaccine passports for clubs and crowded venues, and face masks are still encouraged. So all of those things combined means that we're going into a winter, not only because, well, there's still a pocket, 5 million adults who've not been vaccinated, but unfortunately we're seeing that coverage wane, and the UK was one of the first to vaccinate many of its citizens. So there's a vulnerable patch here of people who are coming down, and we need to get those booster shots up. I'd say at the beginning it looked less convincing of a case that we would need booster shots, and it does have global consequences. But at this stage, I think that the data is firming up that there is a positive effect here.
Anne-Marie, and then you, Kathleen. I'm going to read out the daily death figures in Europe. January of this year, January 2021, a peak of 7,500, down by June to just over 1,000. But by the end of October, again, up to 3,029. I see the problem with vaccine hesitancy. But what I don't actually quite understand is why, if more people are getting vaccinated, if not the ideal number, we're seeing those deaths rise and rise. Anne-Marie?
Well, a couple of points on this. First of all, you have different products in terms of which vaccines are being used in Europe. So you need to look very carefully at what kind of vaccine, what is the waning of immunity that we know from that vaccine. So that's proving to be important to look at. But I think the other thing is behavior, because of course, as we go into winter, people spend more time in enclosed spaces where transmission of this Delta virus is really fast. And therefore, we do need to very much look at non-pharmaceutical face coverings, avoiding crowded spaces indoors. We're going into winter. It's very similar to when we deal with flu in the autumn. So that's probably a combination of things of why you're seeing these cases go up, beyond just the fact that there are still numbers of people who have not been vaccinated.
And is this why, Kathleen, please comment on what you've heard so far, but is this why you reckon the European Union did not quite get it right in the first waves?
Well, the European Union, first of all, they hesitated when they were signing the contract on the vaccine. So they started a bit later than the UK. This was a problem. Then a second problem is the fact that we didn't raise up our ECU capacity. So right now we're in a fourth wave. Just because healthcare workers are really worried that in the winter we will have a problem with a combination of the flu and COVID. As for the vaccination itself, we started here in Belgium in February, March with the elder and vulnerable people. So right now we see that their immunity is going down. So when we're talking about this race of infections, I think it's totally normal. We knew that we would get more vulnerable when we were heading into the winter. So this booster doses where we were talking about is very important. I'm sure of that. But it's not only the vaccination. So we should disinfect, keep distance, be careful, wear the mask, and be aware of the fact that COVID hasn't been gone. But one accent that I would like to pull out is that when you're talking about the race of mortality, I don't really see it like this. When we look at the persons who are dying right now, it are vulnerable people who have a comorbidity or who haven't been vaccinated. And I'm sure that the message that we want to point out to the people is that when you're healthy and vaccinated and you're aware of the problem that COVID can cause you, then you're quite safe.
Anne-Marie, let me ask you about this. We were talking about flu and COVID being a double whammy, and I'll ask you, Oksana, to talk about that in just some detail in just a moment. But is part of the problem not only that the two are coming at the same time, but that for 15, 18 months with the way that people have isolated, they haven't got the propensity for self-protection against something like flu, the natural immunity that you might have had otherwise if we hadn't been shuttered away during a pandemic?
I think there's a very good point you're making. Influenza, we just didn't see it last season the way that we normally do. And so there is some drop probably in the natural immunity to influenza. But the other point I would make, I would really, really support the idea that actually people are generally safe if they're immunized and if they're using masking and distancing. If you look at the rates in Romania, for example, it's important to look not only at the infection rate, but also at the mortality rate. So if you compare, for example, Netherlands and Romania, in Netherlands, you have a very high 14-day average infection rate. And yet you have 40 times less of a mortality rate in a highly vaccinated population than you do in Romania, where vaccine levels are much lower. So it's really important to get vaccinated. It does spare your hospital system. There's one more point about the hospital systems, and that is that people were avoiding care during COVID. So what we're seeing in our emergency rooms here in the United States is a continued load of people who just have not sought care for chronic conditions routinely because of fear and because of overcrowding during the COVID pandemic. And all of those folk are now coming to the attention of the medical establishment. So you're getting a wave, if you will, of non-COVID hospitalizations as well.
Okay. Oksana, comment on what you've heard, and then I've got a few personal questions, if you like, that relate to people from my demographic.
Well, in England currently, the 25% of cases in ICU are COVID related. And in terms of deaths, 85% have been attributed directly to COVID. So if we add flu on top of that, and looking at the other unmet healthcare needs that went without attention for so long, it really, as our colleagues were saying, is going to put additional pressure onto the healthcare system. So I think this is why many countries are now looking at reintroducing certain measures to help ease that pressure after having a summer of maybe more light touch restrictions. So Netherlands, Belgium, et cetera, all these countries are now being more serious about reintroducing certain restrictions once again. And that is due directly to the pressure on the healthcare
This
system.
is my private consultation, and you can all chip in if you like. I'm a man in his early 60s. I've never had a flu jab. I've never had flu as far as I know. I'm a little bit worried about getting one and it then becoming a cocktail of inoculations that could affect me adversely because they might be giving me a booster fairly soon anyway.
Well, you're lucky today because you've got two pharmacists on the call who can talk to you about the adverse reactions. But it's common to have a variety of vaccines given together. For instance, when you're a child, you have MMR. Those are a series of shots. And so having a flu shot this season with your booster is a really good idea. And many countries are now looking at rolling out that booster flu jab together for that reason.
UK?
Well, they're making it available, not exactly at the same time in that sense, but they are encouraging people to book like 2 different appointments, go get your booster and your flu jab. So they haven't synchronized that as seamlessly as they could have, but they are pushing for both to ensure that, especially last year, there was a drop-off. There is a pocket of vulnerability now that we need to address.
Okay, let's talk about the UK specifically, if we may, because there have been various criticisms of the government's approach to say we're sticking to Plan A, which is opening up society. Football matches can still be attended in large numbers. Some clubs are open, rock venues, concerts, theatres, etc., etc. And with the numbers rising, a lot of people have suggested that the government should have a Plan B. Boris, etc., etc. Well, let's hear from him now.
Well, we're continuing with the plan that we set out in July, which was itself an extension of the roadmap that began in February. And yes, we're watching the numbers very carefully every day. And yes, you're absolutely right, Tracy. The numbers of infections are high, but we're within the parameters of what the predictions were.
So he says we're fine. There are lockdowns in Europe, cases are rising there. There aren't lockdowns in the UK, cases are also rising there. So who's got the right approach?
Well, the NHS Confederation, the BMA, they are all calling for Plan B to be rolled out now because of, as we said, the strain on the healthcare system. And the UK, despite the fact that there's COVID cases rising all over Europe and the UK is leading in that front. So again, it looks like we're in a position to wait to the very last possible moment where then maybe more strict restrictions will have to be introduced, and not a full lockdown like we have seen early in the pandemic, pre-vaccine availability, but we could see things like restrictions on households mixing rather than sector-wide closures, but still more inconvenience in our lives than taking small steps now, which is what Plan B would be introducing.
But it's also psychological, isn't it? Marie, let me come to you. If you say to people we're fine, then they feel more accustomed to going out and living their lives as normal, contributing to the economy. Apparently working from home again would cost the British economy around about 18 billion was one suggestion. If you start to say, well, we're thinking about Plan B now, they start to get frightened. Society changes.
Yes, I think that's true. But actually, what I understand, because I have a daughter in the UK, is that the compliance with the existing recommendations, even on the tube, are not optimal. So I think really the UK does need to reinforce the compliance with what they already have and seriously consider more restrictive measures. You know, prevention is always financially wise. If you can prevent the crunch, you prevent a complete lockdown and paralysis, which we already saw with this pandemic. And therefore, you know, really the old saying is an ounce of prevention is worth a pound of cure. And I would really go along with that in the scenario I'm seeing in the United Kingdom.
Well, I think your daughter's absolutely right. I mean, I'm traveling to London a couple of times a week and I'm seeing fewer and fewer people using face masks. In the train today, there was standing room and a lot of people weren't wearing masks. Kathleen, let me ask you about Europe in general. Mostly young people, I would have to say. What's the trend on the continent?
Well, we had a free summer. And then in September, everyone felt as if COVID was gone. And in Europe, many countries use the CST, the COVID safe ticket, to get into events or nightclubs, for example. And it seems as if people think that when they show their COVID safe ticket, then the virus stays at the door and doesn't come into the nightclub, and then everything's open and they're dancing and laughing and having fun. Of course, that's very good, but it is as if there are no more restrictions, and this might be one of the problems, or one of the cause for which we're in the situation that we're in right now. If we look to the map, then we see that the central countries and northern countries have more problems than the southern countries. But in the southern countries, people still live outside, outdoors. So I think those people who are already inside, in their houses, in the restaurants, in the nightclubs, they're transferring the virus. And as they use the COVID safe ticket, people felt as if they were safe, and perhaps this awareness that we still have to be very careful with the vaccine and with the COVID safe ticket might have helped us.
Have you noticed that it's predominantly young people who are taking their masks off and thinking, I'm okay, or is that just me?
Well, that's interesting. At UCL, all of our students have been wearing masks in our classrooms. So, and I think it depends on the setting. When I'm on just observationally, I see it across generations, the people not wearing masks. So, although I do think there is more reluctance to get vaccinated, certainly I think it's younger groups that are still not necessarily convinced that they need the vaccine.
We were told for a long time that they weren't going to be seriously affected. And we know it's the most vulnerable who are going to suffer the most. But are we seeing a prevalence of serious conditions in younger people now that perhaps they ought to be more aware of in Europe?
Well, we're learning a lot about long COVID and those effects, and we're still going to be finding out to what degree these types of post-spiral syndromes can affect young people. And that certainly have been up to 2 million people who have had symptoms, prolonged symptoms for 6 months after the infection, across all ages. And this is really now a time the UK has dragged its feet on vaccinating adolescents. And it's also part of why we're in this precarious position coming into winter. So I think the sooner that we see a higher uptake with 2 doses of vaccines for teens, the less virus we will see in the community.
You see, one of the things I'm concerned about, and you might be able to help me with this, Marie, is that if I get a booster, I'm denying somebody else in a country which has got very few vaccination doses of getting one themselves. Is that a reasonable concern on my part, that I would rather it went to somebody else, or is that just not practical?
I fully understand and appreciate that concern. If you look worldwide, the lack of equity of vaccine access is a critical problem. On the other hand, I don't see any way that individuals can send their individual vaccines away. And so honestly, this has to be a government-to-government negotiation. I think you'll see a lot more rollout internationally of vaccines in quarter 4 and quarter 1 of 2022. There's a lot more people, a lot more nations stepping up for that. At the same time, it is a concern. I don't think it should stop you from getting your own booster if the boosters are available.
All right.
I really think it's very important to do that.
Time is our enemy here, not just COVID, but also the fact that the clock is ticking on Roundtable. So let me ask you this. I'll have to throw this one to you, Kathleen. A year ago, Boris Johnson told the UK pretty much Christmas is cancelled. Doesn't look like that's likely at the moment. What about a European Christmas? Should people give up on it?
I hope they won't give up on it, and I hope we won't have to get in lockdown. I think it's very important for mental health care that we can celebrate the holidays with our family. So I would really focus on getting this booster vaccine, getting vaccinated as lot as people as possible here in Europe, and keeping distance. That's it. But I really don't think that society is ready for another lockdown over here in Europe. No.
And if there were to be another lockdown, what would it mean? If society's not ready, as Kathleen says, what is going to happen? People just ignore it?
Well, again, I think in this instance, if they see that they cannot get the healthcare that they need, and it starts to affect people on a personal level, then I think that the idea that they wouldn't go along with it would be less likely, because it's in this instance we had all the lessons from the previous year that
but
were
COVID fatigue.
COVID fatigue certainly is an issue, but I think that people don't want to harm their loved ones either, their grandparents or parents. And I think they'll take that very seriously when it comes to the fact that we're in another situation with so much virus. When there's more virus, the cases are more severe. So that's why we want to keep it at a lower level. We have less severe cases.
Sometimes seems to me that we started talking about this when I was in my 30s. Listen, thank you, each and every one of you. Thank you for getting up so early on the west coast of the United States, Anne-Marie. Much appreciated out of Brussels. Kathleen, Oksana, good to see you in person, because last time we spoke, I was locked down and doing it from my home studio. Thank you for coming in. And wherever you happen to be watching this edition of Roundtable, we thank you very much for giving us your time and your understanding. From me, David Foster, and the Roundtable team. Until next time, goodbye.